Happy Thursday, everyone. Thank you so much for joining me for today's fourth session of the Pieces of Systematic Review with Margaret Foster. Margaret, at this point, probably needs no introduction, but just in case any of you are unfamiliar with her, she's an associate professor at Texas A&M University and serves as the Systematic Reviews and Research Coordinator at the Medical Sciences Library with a joint position at the School of Public Health. Her work with systematic reviews began more than a decade ago while completing her Master's of Public Health, and in her current position, she provides consultations for researchers in medicine, public health, veterinary medicine, education, and other disciplines, as well as having published over 30 articles applying or describing systematic review methods and evidence-based practices. In addition, she's a co-founder of the Medical Library Association Systematic Review Special Interest Group and has developed a popular continuing education course about systematic reviews, which has trained over 1,000 librarians. I'm going to pass things over to Margaret and let her get started. Hi there, Margaret. I think you might have remuted yourself again.
Oh, sorry.
There we go.
I was too quick on the draw there. So good afternoon, everyone. So today we're working through the steps of the systematic review process, and this session is all about the letter C here, talking about collecting the different pieces of data from each study, and we'll talk a little bit about synthesis. We'll get into a little bit more about that when we have our last session, which covers the E and S of this process. So this is just a quick slide. You get to see my picture there, and the title of the book that I wrote with my co-author, Sarah Joel, which kind of started using that term, the pieces there. Okay, so this wanted to give a quick overview about this series. We will have one more after this, and this was my attempt to walk you through the steps of this process using both a scoping review and a systematic review. And so this is the agenda for today. I thought I'd shake things up a little bit and start off with a pop quiz and discussion with everyone. And then we'll do a little recap of what we talked about last session, and then go through the overall idea behind coding the steps, and then look at how those steps would be applied in working with our pretend clients here, looking at the case study 1 and 2, and then doing a wrap-up there. So starting off with a pop quiz, I wanted to give you a series of 3 questions that have come through my doors recently, and talk about them and what type of research question do you, review type do you think they match, and what questions would you have for the client. So please feel free to type in the chat box there. And so I thought that we could have a kind of discussion here about this one, and then I have a couple more to show you. Okay, so a lot of you in that BC area. So having that big impacts part in there is very, it's not very clear what are they looking at there. Just it's kind of a, it can be very subjective. What do you mean by impacts? Yeah, so for this review, after I was able to talk with them and see what were they thinking, although there have been articles or there have been studies, especially dealing with safety, that they could have collected all the articles that were just focused on safety and automated driving and potentially combined those together and done a systematic review. They didn't want to be that narrow in their question, and so we ended up deciding that they would do a scoping review. And we would look at this intersection of automated driving and public health and what's been studied. And then maybe later on they might come up with a more specific question that could look at, do a systematic review on that. Okay, let's try another one here. Okay, so most of you are seeing this as a narrative review here. And maybe you could turn it into a scoping review. What do you think it would take to take this and turn it into a systematic review? Anybody want to take a stab at reframing it for a systematic review? Yeah, so that's really good. And that, Mark, that's exactly what we decided to do. After talking with the group of researchers and trying to understand what they were really looking for, we decided to look at qualitative studies where they were interviewing parents, and then they could then pull together the themes from there to try and answer this. But the way that it's framed here, that would not be a systematic review question. And I mean, this is even more of a primary study kind of question that you would expect. But what we did have to try and narrow down on, we narrowed it down to just looking at vaccinating infants, because you could look at different types of vaccinations, different age groups. We decided to go with babies, and we also just wanted to look at one type of vaccination as well. Sometimes, whenever people ask the question, I try and delve in with them further. I don't immediately cut them off and say, that's not a systematic review, but just, keep working with them through their thinking and what are they looking at. Sometimes clients really want to do a systematic review and they're willing to move, reframe, do whatever they can to their question to get to that point. And sometimes they really stick to their question, and so they're shopping more for which method should I use to do this. So just talking through that with them really helps. Okay, here's the last one. Yeah, so pretty much all of you were saw that this was a more specific question than the other ones that we were looking at. This is actually a trickier question than it seemed, as we ended up having to be even more narrow in how they were applying the bikeability, the score, because different studies, we found they were doing it in different ways, and it was going to be hard to compare, so we had to narrow it down even more. And then as the student started collecting things and she found out that there were many other types of assessment, she wanted to include more and more. And then we got to the point where we felt like it was really on the line in between a scoping and a systematic review. And for her purposes and what she was really trying to do was to ended up comparing different likability assessments and helping city managers and different groups to figure out which was the best, most efficient or most affordable or what they could do. So she ended up deciding to do a scoping review. Just working with her through the process, we were able to figure out what was best, but it did take a while. And of course, she had several stakeholders that she had to report to. And so that happens sometimes. She had the best intention of doing a systematic review, but for other reasons, they get talked into to including more and more. And so it didn't really change a lot of the steps that we did. Of course, it did make our search much broader as she wanted to include more and more. But it was really interesting. I've learned a lot about that term, bikeability. So I hope some of those examples were helpful to you. Maybe you're having these same kind of questions walk in your door. So just wanted to kind of talk you through and touch base on that again. Okay, so now we'll do a quick overview of a recap of what we talked about in our last session. And I just want to put a reminder in here that how I'm working through the steps right now is what I work with when I'm working with my clients. I really want them to build up the protocol, so I want them to work through all the steps. And even though last time I was showing you like giving them all the results of all these searches, I wouldn't necessarily do that work at this point. At this point, I would have probably only given them 100 or 200 articles to work through, because really until they've worked through and designed their whole protocol, giving them everything can actually slow them down in the process, because they get so involved in sorting the articles that they forget they haven't worked out the whole protocol yet. And sometimes when they get to the coding part, they realize what their actual question was and what's really important to them, and then they will change actually their question and their eligibility criteria. So this is a really important step for them to have worked through before I finish up everything. So I just want to put that out there. So last time we focused on evaluating what they're getting back. So that's the screening and critical appraisal. And then we talked about the extended searches. So I just have a few slides on that. We talked about screening by title abstract, and then selection is by full text. And so a lot of the experts, they differentiate between using the word screening, and that's just when you're looking to see, should I bother reading the full text? So you're looking for reasons to kick it out, not reasons to keep it. And then selection is by full text, and then that's when you're looking to see that it matches all of the criteria. And so usually I need to have that conversation with the researcher to describe the different mindsets that they need to have, because otherwise then they'll start kicking things out at the abstract level that may really be something that they want, but because in that abstract they didn't fully describe all of the outcomes or different issues that they might be looking for. Sometimes that happens. And then we talked about sorting, and this is where they've got to take those included articles and then look to see what are the actual studies that are here. Because while it is most often the case where one study equals one article, sometimes 2 or 3 articles or reports equals one study, and in some cases, one article equals multiple studies. And so they really need to take all of those included articles, create a table of that. If they are including more than one study type, they've got to also sort them by study type, and then that's going to lead into the appraisal process, where sometimes they just have one study type, so they only need one checklist of appraisal, and sometimes they have multiple ones, so they'll need multiple ones. Many times people will decide to code and appraise the risk of bias in one step. So I will be talking about that again a little bit here as we go through that. And then we also last time talked about the other, what I call the expanded searches. So those things that you might do beyond your typical subject database searching. And so I went through the MECR standards. These are the newish standards from Cochrane, which are freely available online. And they differentiate between mandatory and highly desirable. Looking at trial registers, the gray literature, searching at relevant reviews, the reference list, and even leading to contacting individuals and organizations. So we talked some about that as well last time. Do you have any questions about either of these? Okay, so now we'll get into talking about the coding process. So I'm going to talk through about the overall steps of the coding process, the role that you can play in it, and this will especially involve talking through with your client about data management issues, some workflow things, which are things that I think most of us can really help with. It may not be that we fully understand their topic, their clinical issue, whatever that is, but we do deal with a lot of data and can help them with that. So I think it's really helpful. So these are the overall steps in coding. And so that first step is drafting what are the important characteristics from each of these studies that they need to collect. And for each of those, they'll need to think about how do you do that. And we're going to talk about each of these in depth. This is just like a quick overview slide. And then they need to develop their form. So they need to think about what kind of software do they want to use, who's going to be involved in that, talk through the workflow, and then they've got to pilot that workflow. Test, are they, as a group, agreeing on each of those? And so they'll need to keep working through some articles, some study reports to get to that. If they have more than one study type that they're working with, I suggest picking one example study from each of those study types to test and see how that's working. And then, of course, they'll need to complete this process when they do the full review. And then they'll need to think about quality control as they do that. So now we're going to go through each of these steps. So here's some overall ideas I have when I'm talking with a client, and sometimes I kind of visualize with them these steps. So I ask them to imagine that they have this stack of their study reports. Let's say they have 20 studies they're going to be working through, and they're creating a form that they're going to take each one of those study reports and fill out the form for it. So I kind of describe it that they're trying to wring out all the important information from that study report and get that in a form. So sometimes people are very tempted to write a very kind of generic form where it'll just be like just a couple of things, methods, results, and then just kind of write a paragraph in each of those kind of sections. And then the problem is you're just writing paragraphs that then later on you're going to have to resort. Or if you just ask a few questions of each study, you're not really getting all of it, all of what as you're reading it, you want to, you're not getting all that information. And the form also has to be flexible enough that, especially if you don't know what all of the categories should be, you want to be flexible, you want to have others, and you also have to consider that sometimes that information will not be reported. You also want to think that this form is a tool to get you to those tables, graphs, whatever it is that you want to be able to do with that information. So you want to put the information into the best form or whatever you need for that. So they do have to think through what kinds of synthesis and analysis that they're going to do in order to make this the most useful. So in drafting this, I suggest that they start listing out those characteristics, just brainstorming it, and then go back through each one of those and think, okay, is this going to just be an open type of question where I'm just filling in text? Do I know some categories? How do I want to collect this information? They will also have to report how many people were involved in this process, how were the studies divided, what kind of software they used, and how disagreements were settled. And so this is what they'll have to write up in a paragraph in describing this. And we're going to look at some examples as we go through today. So in thinking about this list, this is one place where you can help in showing them a few lists that we already know are available. So the Cochrane Handbook has a table, which we'll look at in a few minutes, which lists out what they look at when they're looking at randomized controlled trials. You can also look at the methods section of a related review to see what did they do. For that type of study, you might go and look at the Equator Network. So there are reporting standards for all these different types, study types, like randomized controlled trials, observational studies. You can see the different ones here. And the Cochrane Public Health section also has freely available their data extraction form. So there's many other places where you could look for examples here. These are just a few of them. So this will really help to kind of jog or help them to brainstorm what to look at. So this is an example from a scoping review that I found where they describe the process that they did. And here they say that they used, they did go and look at the Cochrane collaboration tool, and then they also used the Tidier checklist, which is a checklist of what should be reported when talking about an intervention. And then they list kind of very generically here. I think it would have been better to be more specific, but they do. And the wording that they're using here does come directly from the Tidier list, which I'll show you in just a minute. So they kind of describe overall the types of characteristics that they were looking for. And then they go into some more details, talk about study design, setting, and that. I think it would have been more helpful if they would have described at least the population characteristics a little bit more the outcome measures, what specifically were they going to code for, things like that. But this is very typical of what you see written up when they're describing their coding. So let's look a little bit more at the tidier. So this is from the Equator Network. I was able to go and look up tidier because I knew that was a reporting standard. And they provided a link to the PDF from there. And then I could see, oh, the way that this one is written, they go through this why, what, who, which is how they were writing it up in their app in the methods section there. I don't know that this one is particularly that helpful. It's they have a lot of information in each of these. I think it would be better to break down the information more. So we're going to talk some more about that as we go through. But this is an example of places where they could look to see some of these items. I like how Cochrane breaks it down, and so this is from the Cochrane Handbook, their table 7.3a. And so these are the things that they ask reviewers to collect on each study. So kind of at the beginning, it's who are you and which study are you coding? They want to make really sure at this point that should you really code this study? So they have reviewers look again at eligibility, and if they're going to kick it out, why did they just kick it out? And then they work through the methods, the participants, the different information about the intervention, outcomes, and so on. And Cochrane does show in this table that there are items on here that would be part of their appraisal, which has those, it has 7 items that they look at for randomized control trials. And then you can see they work through the results and then miscellaneous things. So when I'm talking with researchers about this, if they're not doing a randomized control trial or interventions, not all of these would matter to them, but certainly most people that I work with are looking at some type of population, and so some of these characteristics will matter a lot. And then there may be others that are not on here that they also want to look at. One thing that sometimes they need to code for is the diagnostic criteria. So, for example, in both of these cases, we're looking at depression and diabetes. So you might look at, well, how was this clinical depression? Was it just the person saying they were depressed, like depressive symptoms? What were they looking at? So these are all the types of things I might talk through with them. So in designing those questions, I kind of talked about this a minute ago, but you really want to break down the characteristics into individual components, not compounded. For example, if they just have on their form a big blank that just says methods, and they can type all kinds of things in there, later on when they have 20, 30 studies coded, and then they go back and you look in that column, they're going to have to recode that whole column based on that paragraph that they typed in there. It's better to break it down into what is it about the methods that you want to look at. So it could be the study type, randomized control trial, cohort, whatever, the length of the study, who was providing the intervention, all of those different components of the methods. They really need to break it down so that in the end it's the most useful information. And it also is more efficient to do it in this broken down this way. They also need to consider different types of questions they could do. If they need to be able to mark more than one option, maybe it should be a scale type of question. And for as many as, for many of the questions, it's also important to put in a not reported option. because you just never know, even though you might consider, of course they're gonna tell me that information. Because what you don't want is if you're working through all these studies and then you get to one or two and it's not reported and you don't have any place to mark that, then you're going to have to, have a notes section or something else to try and get back at that. So I just try and build that in as much as I can. And so for both of the case studies, we're going to work through some of these. In developing the form, there's different software or ways of doing this I might think of. Of course, there's just the regular old pen and paper idea. I haven't had anybody in a while do that, but I still occasionally get people wanting to do it that way. I personally wouldn't want to have to type up or deal with that. We see a lot of data extraction errors in that. And you also see errors when looking, when doing it as a big spreadsheet. Many of the experts really recommend not doing this, even though I still have plenty of people who want to do it this way. There's a lot of different issues that can come up with that, especially if you're trying to do it in a blinded way and then recombine it. It's just not very efficient. The way that I have done the last kind of 50 to 60 that I've been working on is using a Google form. It's just free, it's available online, and it's fast. But then certainly there's review software that's out there that can do that. I used to use RefWorks, so I used to use bibliographic software to do that. There's been an article talking about using EndNote for doing this. And then sometimes I have groups that design an MS Access database to do this. What it boils down to in the end is this coding form, like I said, is going to be nothing but a tool to get the tables and graphs they need at the end. So whatever is most efficient at doing that, and of course I don't have to do the coding, so if they want to, use the pen and paper or Excel, that's always an option. But I do try and show them examples of what it would look like if they did it a different way, so they would at least have some idea of other ways that they could do it. It's really important to pilot this with all the different people that are going to be coding. Sometimes they're not sure, oh, should I collect this? So there's this kind of balance they're trying to make between overcoding and undercoding. And I just want the form to be as flexible as it can be. So I'm like, well, if you're on the fence about it, just collect it so you don't have to go back through the pile again. But if you're really adamant that you don't need it, then why collect it? I've done many projects where I did not code anything but the methods, so I didn't record any of the results because that wasn't the purpose of my review. But for others, that would be really weird. Oh, why didn't you record the outcomes and things like that? What I do whenever I'm testing a form is I will take the study, I'll work through the form, and when I get to the end, if there's information that I have but there's no place for it to go in the form, then that's a reason to add something else. I also try and build notes section throughout the form so that when interesting things pop up, I'll have a place for those to go. And then I always encourage them, anytime they're quoting anything, put it in quotation marks. It's really easy to get to, at the beginning, you think, oh, I'm going to paraphrase everything. And then as they get more and more tired of coding, they start just putting in direct quotes from the study papers, but then not putting the quotation marks around it. So I just try and have that conversation with them early on. I did once have a researcher that got into some big issues and had to go back and recode many things. because they couldn't tell the difference between the ones that they paraphrased and the ones that they direct quoted. So I learned my lesson from there, and I always try and have that conversation. And of course, at the end, they're going to have to code all of these. I strongly suggest that they meet on a regular basis and then kind of bring together, if they're, especially like they're working in pairs or however they're doing this, but compare those, their coding of each study and see how are they, how much are they agreeing, what are the issues, because you just don't want to have to do all that work at the end and maybe you figure out early on an issue that you're having, something like that. Because even though you'll pilot this, then as you're working through the pile, things will come up. There have been studies that have been done on data extraction, and this article here brought together several studies on data extraction, but there haven't really been that many studies. I think they only found 6 in this review here. So we don't have a lot of information about what not to do, but we do know that it does help to have at least 2 independent researchers coding each study. They saw up to about 50% error, and they were trying to compare different ways of doing this, but they weren't really seeing one way over another, and that's like software, different things like that. So I think there's going to have to be more research done on this to really figure this out, but we do know that it does help to have 2 independent coders on each study, which is the standard. So I just have a little bit here about synthesis types. Most systematic reviews are only going to be synthesizing in a qualitative way. This is an example of what they did in this scoping review, where they were trying to look at how are people using this blockchain application. So they were just thematically placing all the studies they collected into different applications. Then when we're doing a systematic review, all the studies that we're looking at are all very similar, so then you would have different ways of combining them, and then how you're presenting the data to the reader is really going to vary. We'll look at some evidence tables here in a little bit when we get into the examples. When they can do a quantitative synthesis, this is where it must make logical and mathematical sense. So I just put in 2 slides in here about meta-analysis. Basically, a meta-analysis is done when you can treat all the different participants across all these different studies as if they were in one big study. And so it has to make that's where it has to make logical sense that you combine them. And then it has to also make mathematical sense. What I have on this slide and what I just said pretty much completes my understanding of meta-analysis for when students get to this point of their project. This is when I send them to go and see the expert that we have here on campus to work with them. So I didn't know how interested y'all were in talking about forest plots, which is what I have here on the screen. I'm sure that some of you probably even teach people how to read these. Does anybody have any questions about this? And I would just stop here for a second. Okay. So then I just have one more slide about meta-analysis, and this was just a little bit about the funnel plot. Only in meta-analysis, only in meta-analysis are you able to graphically present potentials for publication bias. And so that's done with a funnel plot. Sometimes the forest plot and the funnel plot get kind of mixed up because they both start with F. So the funnel plot is just read graphically, and it's trying to figure out, do you have a potential of missing studies here? And so the first one, the bigger one that's here, I kind of say you're trying to look at it like a Christmas tree, and so you want a nice full Christmas tree, and so here we see that where it's very balanced on both sides. That's another word they'll use for it, is they'll say balanced. And then in the example over there on the right here, I guess, the B, this is where there's potential that some small studies are missing. So this could be that they decided to just limit to peer review. And then for the A, this is where they might be missing some studies. And this is what it would look like if the true effect size was 0. So they mean it's really the intervention's not harming or beneficial. It's really 0. So both of these are showing publication bias. So I just wanted to kind of put those out there so you could see what they would look like at the end. As far as the protocol goes, they would just describe what they were going to do, so what they were going to combine together for the meta-analysis, and if they were going to do a funnel plot to try and measure publication bias. So now we'll get into the case studies and talk through how I would talk with a client about coding. Oh, as librarians, are you expected to know this? No. Like I said, I just work with my client enough till we get to the point of they're considering a meta-analysis, so they go and see the expert about that. And like I was saying, that explanation that I gave you about meta-analysis is as far as I go in talking with them. But I think it's nice to kind of know a little bit of the vocabulary. And funnel plots aren't terrible to kind of sort out. So when it comes to publication bias, where you are not doing a systematic review, where you're doing a systematic review but you couldn't do a meta-analysis, then you just have to say in words, was it possible that you missed something? So, for example, if the researchers wanted to limit to English and wanted to limit to peer review, and we couldn't do a funnel plot because we didn't do a meta-analysis, and if I were an author on the paper, then I would say, okay, I want a sentence in there saying that we have the potential of publication bias because of those two things. And of course, I would discourage them from doing that, but I want I want to be able to write that in. So, so I think it's more of knowing what those things are when they bring it up, and knowing how to read meta-analysis and when they talk about that. Otherwise, I don't think you have to understand all the specifics of it. So this is a reminder of case study 1. We were looking at a scoping review, and we were looking at adolescents with either type 1 or type 2 diabetes and its association with depression or suicide. And because it was a scoping review, they were open to interventions, correlations, different types of studies. So when I meet with that client, I want to talk with them about how's their screening going, because last time I gave them more articles to work on, and I had asked them to start building up their coding form. And so we're going to talk through that. So the first thing we'll do when we're trying to build up a coding form is we'll go and look at other reviews that have been published on their topic to see what they might consider coding. And so in this case, I found this related article to their topic. And when I looked in the methods did not describe the coding at all. So the other way I can look at hints for coding, what they coded, is by looking at some of their evidence table. So, so this is one of the first ones that they had, and so we can see they coded the number or the sample size. And for the first article here, they coded for how many had type 1 diabetes. We'd have to see what that CG stood for. So I'm not sure, I didn't put the bottom of the table on here so you can't see that. But for the rest of these, you can see they just kind of put them into one big group. So we don't, from here, we can't tell a lot about is it type, how they were doing that or what that meant. We can see that they looked at countries, how many centers were included, how long did they follow the patients, and then what were the outcomes. So this is kind of a dense table as far as the outcomes go. It would have been nicer to kind of have it spelled out. Oh, thank you. That's good. That's a control group. So in this case, all of these might have been different study. These are different study types. I'm guessing here I haven't seen that CSS as, I guess they're mean cross-sectional. And then they must have a control group for some of them. Anyways, so it starts to give you some hints into what their coding is the main point I'm trying to make here. And then here's another table that they had, this one where they added in some more characteristics about the patient. So here we can see they broke, they had the years, the average age, gender, how long had the patient had type 1 diabetes, and then some other information in there. So when I'm presenting to this a client, it's just things that they could think about coding when they're doing this. So then sometimes they'll bring a draft of what they've been working on. And so because this is a made-up project, I just made up a table, and I thought we could talk through some issues. I tried to present some issues that I see clients do whenever they're given this task of coding. So in looking at what they gave me, what are some issues you see with this table? Yeah, so they don't have a standard language here. I'm missing them. We only know the sample size for one of these studies. Yeah. So there's some issues with the study design. Mm-hmm. So do the different methods matter, qualitative versus quantitative? So in this case, they're doing a scoping review. And so one thing we're trying to do in a scoping review is trying to figure out the broader overview of the different types of study questions that have been answered on this topic, different methods that have been done. So we would want to break this down. The biggest issue with their methods in here is they might want to categorize this in a different way. Oh, that's really good, Nancy. So when they're looking at the strengths or weaknesses, is this from the author or from the review authors? So y'all have started pulling out a lot of the issues that I saw when I looked at this table. So this next slide, I tried to kind of highlight some of these different issues and talk to them about it. So the first thing that I see when and this happens with a lot of researchers I work with, is I'll look down the population column and it's really inconsistent. And they need to break this down some more probably, although they might end up presenting it in a table combined together. When they're collecting it, they probably want to do it separately to make sure that they're getting all the pieces, potential pieces there. So we really have to know the sample size for all of these. For the first one, we don't know anything about the gender of the students. We only know that for the next two. We don't know the age of any of these groups. We do know that in the first study it's 9th and 10th graders. So there's just a lot of inconsistency there. Under study design, face-to-face is not a study design, and neither is pre and post. So we probably need to have some kind of standard language for there. Methods might be okay. Probably need to work on that some more. Maybe even combine study design and method together so that they could have more room for other columns on here. Like I said, I kind of just made this whole thing up here. And then I see this a lot when they'll have like this kind of open box and they'll just write strengths and weaknesses. And then I'll say, okay, so are these from you, from them? Where did this come from? And so they usually need to break this down for themselves into two separate boxes. So what were the reported strengths and weaknesses, and then what did you see? It is not required, or you don't always see critical appraisal done of these studies in a scoping review. But I think it is good to do at least some of that. And depending on how specific the question is with the scoping review, they might even do a similar thing to what we do with a systematic review and do a checklist. So I hope that you can kind of see from this example, even though you may not be expert on their topic, there are ways that you can help them at this beginning point when they're trying to think through what should I code and talking through with them. In this case, I'm always treating myself, I'm an outside person, I'm a non-expert trying to read your table. Can I understand what it's saying? And tables should, for the most part, be able to stand on their own. And so I talk with them about that. Now, this person was deciding to do their coding form as a table. I encourage them not to do that because of the issues I talked about before. So I might even kind of take their beginning table and show them how they could turn that into a form and what they might be able to gain from that. Okay, then the client may start to ask me some questions. So I put in here that dreaded question of, what about Google Scholar? For the most part, I don't search Google Scholar. I'll try and use lots of other gray literature tools to do that. And I am by no means expert on GrayLit. But if they really want to say they search Google Scholar, just talk to them about, let's set some parameters. What is it they're hoping to get from that kind of thing. I just think that there's other GrayLit tools out there that can be more helpful. And I'll encourage them to not worry at this point of developing their protocol in how much more we're going to collect. I think it's more important to focus on what is it that you're going to do with the stuff that we are collecting. And I kind of describe it as you're building the factory. I gave you some stuff to work with. You're thinking about the screening, the selection, the appraisal, the coding, all those steps. And until they've worked out what all those things are, it's not really helpful to just keep collecting. So this is a conversation I get to have a lot. Okay. Things that I suggest that they do for their next meeting, work on their forms some more, finish up their protocol. Yeah, I like that point, Dave. They can be very sparse. So, but you're always going to have those clients that ask you about it, right? So I encourage them to work on their protocol, and then hopefully by our next meeting where we're looking it over and getting it ready to, if they're going to register the protocol or just kind of finalize the protocol, and then at that point get all the records that we've collected. So do you have any questions about scoping reviews and this case study before we move on to the next one? Okay. Well, if you think of something, we'll have some time at the end as well. So here's a reminder of case study number 2. So in this case, we were looking at a correlation systematic review. Sometimes they call it a harm or a risk factor review, where we had the population of diabetic patients, and they were specific that they only wanted adults. They're looking at physical activity and its effect on depression. So when the client comes in, then I had asked them to kind of start working on their coding form and then keep working on the protocol. So we're kind of working through that. So then we looked at a related review, and these are some excerpts from this review's methods. So what are some things that you see in here that is wrong or problematic? Give you a couple minutes to look at it. But does anybody see any issues in the search strategy paragraph? Start with that one. Okay, so these are all good points. For some of these, they have different interfaces, so we don't know the interface. We have no dates. Yeah, there are a lot of issues. Um, so my first problem is in the very first sentence, they say they searched 13 electronic databases, but they didn't give me all of them. So, so I don't even know all the resources that they searched. I don't know the vendors. I don't know the years covered. I don't know the actual search. They spelled PsycInfo wrong. So there's just so much. It's just like 2 or 3 sentences there wrong. They tell me a little bit about the concepts that they searched. I have no idea how they were combined together or why they did that. No, this was the actual full text of this. I'm pretty sure I got it from the full text. This is the full text of it. The purpose I did summarize. I got that from the abstract. Yeah, this was the actual paper. I hope I'm right about that. I think I am. Another problem is here in the search strategy, they're starting to give me results. So here they say they're telling me how many came from the ancestry search. And then I see that again in the data extraction. They're giving me results and not focusing on the methods. So this is very typical thing that I see, especially for somebody who's new to systematic reviews, is they start putting results in the methods section, and I really encourage them to wait until the results to tell me what happened from what you should be putting in there. Here in the data extraction area, they didn't really tell me what they were extracting. They're just kind of saying, hey, go look at the table. Then they have this some kind of quality measure where they are telling me what they're looking at. Cochrane suggests not having a scale where you're going to take, if you have to get a 3 or a 4 or whatever it is on their quality scale, because some of the things that are on the list are more important than others. So if you're going to kick out something because it doesn't meet a certain criteria, list out those criteria of what's most important. So Cochrane has really gotten away and doesn't do this kind of having a 1 or 2 or 10 or whatever it is, just having a checklist and presenting the data. So hopefully you can kind of see the range of what we see in the published studies on how they're describing data extraction. So we've seen an okay data extraction description. We've seen a no data extraction, and this is an example where we needed a lot more information to understand. I don't know how many people were involved in the data extraction. I don't know if they used any kind of software or anything. I don't. There's a lot of information missing from here. Okay, so then I go and I can look at their tables. And so I see in this first column, they have purpose, and then they have another column, subjects, things like that. I hope that you can read this okay. What are some issues you see here? Yeah, I'm sorry that it's blurry. I hope that you can read it enough to see or comment on some issues here. Yeah, so the first thing that I noticed when I looked at that is this is supposed to be a systematic review where I thought that they were going to be looking at um, potentially interventions, maybe. I wasn't exactly sure what they'd be looking at. But when I looked down the purpose, the first study on here, that study was to design an instrument, and then the next one is to evaluate the association. So they're mixing there's three different study types on here. And this isn't a systematic review because these are three different studies answering three different questions. So really, if they were trying to look at the association between depression and adherence to lifestyle, it probably would just be looking at the cross-sectional or survey type, which would not have an intervention, which would be the second one on here from Bell. So the biggest issue here is they included their criteria was not set correctly. I can see a little bit on here about what they were coding. So they were looking at different instruments. I probably would have separated out the depression instrument from the diet instrument from the physical activity instrument. As a reader, I think it's really hard to have all of those combined. And probably when they were coding, they did separate those out. But just this is all over the place. So, you know, sometimes you look at these tables and they're helpful and kind of giving you hints about things you could think about, and other times it's like, oh, it's a mess. But it's also a lesson in what not to do as well. So it's very confusing to try and read this and see what they were doing. Okay. This is another article, and this was the tables that they did. So I know it's still a little blurry. Hopefully you can read them okay. What do you see here? Yeah, it's easier on the eye. They have less information combined in each column. The single question. Sometimes when they were grabbing these, I think there was just one question asking the patient about their physical activity, and in other measures there were several questions. So I think it's about the scale there, how they were measuring. So hopefully from this one you can see it's a little clearer what they were collecting. It's kind of broken down more into the components. And so when you're reporting it, you might combine information together. And this is just giving us hints as to how they were coding. But it's also helpful for the client to think about what do they want their tables to look at the end as well. So this is where they kind of do a little bit of back and forth. Yeah. And so it's a big problem whenever people are doing, trying to look across studies here, because there's so many different scales for depression, for physical activity. And because I actually did this systematic review that we're talking about for this one, his focus was on the assessment tools that were used. So yeah, it is important. We do want to know about these different scales because if you really wanted to do a meta-analysis on this, you probably couldn't logically combine these numbers together because they were two different, the scales they were using. So the review that we did was trying to look at all the different ways, what were the most common, what's going on, and then as different physical activity standards are set, I think the new ones just came out last November, then the scales that are used might also change. And so systematic reviews can be pointing out lots of different things about research, and one of those things can be, hey, in order for us to really see the big picture, we've got to start using similar language, similar scales to really measure this. Okay, so so this person that I was working with, they hadn't really developed their coding form yet. So I decided to show one that I had already developed in Google Forms. And so I kind of have some screenshots of that form here. And so this is where I was saying, okay, the first thing, because you're going to have multiple coders, is we've got to mark on the form who coded the article. I copy and paste into a drop-down question in Google Form. And I number the studies and I also put in the title. Because I find that if you don't have both pieces of information, it's too easy to pick the wrong number, like it's 17 and you pick 19 or something and don't realize it, because there isn't any more information on there, so I usually put both of those in there. And then you see on this form, I actually had, yeah, they get transposed, yeah. Actually had a screening question as part of my coding form as well. For this particular project, we were looking at medication errors in from observational studies of ICU nurses. And so we only wanted observational studies. And what I found was people, through the full text selection process, had let things in that didn't really match that criteria. So we added this question to help with that. But it's just a good check kind of thing to have as well. I wanted to kind of show the researcher what they would get by using Google Forms. So I took this one question that I had on my form where I had no idea what the countries were going to be, what the patterns we were going to see. And so I said, well, I know it's either, we could label things as US and not US. And so this was the question, this was my draft form of this question, where I even had it where you could mark multiple things as well, because I was trying to play with this and figure out what should we do. And so in the other, I had where you could list the other countries. And then as we did this, we started to notice that we had a lot more things that were from other countries, and Google started giving me this summary. So this I got from the summary screen in Google. I didn't have to create this, and this is one of the things that I like about using a Google form is that it will do those summaries for me without me having to do it if it's a question with options like this. One problem, though, when you're looking at this is the fact that I have each study is coded by 2 people. This coding result won't really help me at the end. So I'm going to talk about some ways that you can deal with that. Anyways, this was the way that we worked on the risk of bias. So I used Joanna Briggs' checklist for observational studies. You have some different options in Google Forms. So this type of question is a matrix type where all the questions have the same options for answers. We decided to we did take out the does not apply and decided that we were just going to go with these 3 options. We also had to decide who's going to participate in this step. Was it going to be everybody? Was it going to kick out things because of this? So I might have to have 2 Google Forms, one for the appraisal and one with coding, or maybe I just decide to do them both at the same time. Most people do both of those steps at the same time. This is going back to the part about screening. So from the summary screen, you can click on the spreadsheet, which is going to give it to me as a Google spreadsheet, so I just have all the answers there. I can also see the individual answers as well. Did you have a question about the screening question? Let's see. I don't know, maybe you're typing a lot. I want to try and answer all the questions I can today. So if on this screening one, if they were to answer no, they would be done with the form, because then I did not want to code that article at all. So they had to say yes here to continue. So maybe that answers your question. Just have a few more minutes, so I want to make sure I get to the end here. I just have a few more things to show y'all. So some questions that the client asked me, they brought me 4 articles and they said, hey, these didn't come up in the search, why not? So we're going to talk about that in a minute. And then they did ask, okay, so what are we going to do about double coding? And how do we keep track of the studies as we're doing it? So I just had this slide right here to show a little bit about what I do when I'm double coding. So when I go and I look at that table, I'll sort by the study name, and then you kind of see that it falls into this. And this is something that I'll do early on in the process, because I want to see how are we coding, are there issues with the questions. So when I looked at the setting, we had categories already set, but maybe we need some definitions of what they mean, because for study number 1, coder A said that it was a church and coder B said it was community. And so maybe we need some definitions in there to make sure that we're clear. And then for the provider, they were like, oh, we don't know who these providers are going to be. Let's just have it be an open text. So you could write anything in there. And then maybe there are some categories they could think of putting in there so that they can get some more consistency in there. So here we see there's teachers and educators, which in the end, they might just decide, okay, we're going to make that one provider category. So these are some things they can do. The other thing that I'll do is, so that I can benefit the most from the summary that Google Form does, is you can actually, once you've created a Google Form, you can create a copy of it. So what I do is I have all the people that are coding. Every study is going to be coded twice. Go ahead and you work through all those once you're happy with your form. Then you would go through, and then for study 1 here, they've finished coding it, everything, and they go back and they could recode it in the copied form online. And so I had a case where we had to code 40 studies. So we ended up with 80 coded forms. And then as the teams were sitting down and working through the issues for each study, they re-put their information back into that new form that's all nice and blank. That was the final answer. And that way they have a nice clean table to work with. They can benefit from the form because it's easy to put the information back in there because they already felt very familiar with it. So some people decide not to re-put it in the form. They just clean up the table and do it that way. So it's kind of up to them, but I just present some different options that they have. And not everybody I work with does a Google Form. Some choose they just want to do it as a table, or some will use some of the different review software that's out there, like Covidence and others. So things that I talk with a client at this point is they need to develop their form, keep finishing up their protocol, and then for me, well, I've got those articles to work on that they said, hey, these didn't appear in the search. So I don't know that we have enough time here to go over this part of it. Oh, we can see how much what we can do here. So this is just an example of a search that I did. And so you can see I've got concept A, B, C. I ended those together and then I added my limits. So that's line 5 is like the final that I had given them. And then they give me these 4 or 5 articles that they say, hey, we didn't get these, what's going on? And so then I put those into the database and I see what comes up. And then I start comparing them to the search that I did to try and figure out why didn't they come up. So I wanted to kind of show you all this is the way I work through questions like this to try and figure out what's going on and if I need to update my search. So are y'all interested in talking through this? I don't know if this is helpful. So line 11 is where I'm just ORing together. I'm trying to get all the articles that the author, that the researcher had given to me and said, hey, these aren't appearing in the search. Yeah, so Article 5, I'm not going to worry about trying to improve this. I can't use that to improve the search because it's not in there. So I say, oh, I'm going to have, maybe we didn't, I'm going to go and test it against the other databases that we searched to see. So I just wanted to show you all the different things that can happen when you're searching. So in that case, Article 5 didn't come up because we didn't have it. So what does number 12 mean? Okay, so when I look at number 12, 12 says, looking at the line that we got all of our articles, so that's those 600 articles there. When I AND that with the 4 articles that do appear in this database, I got 1 article back. So that means one of the articles that the client gave me, we actually did get from the search. And so what that tells me is probably if I go back and I look at what they were sorting on, this one article, they probably excluded it at some point. And then later on when they were looking around at things, they found it again and they said, oh, I need to include this. And so I have to go back and try and figure out what happened with that one. But as far as the search is concerned, I'm not worried about updating that one. I don't need to worry about fixing the search because the search was fine. So these other lines are just ways of working through which concept is causing, or maybe we need to add more synonyms to that concept, causing that article that they gave me not to come through. So I know we don't have a lot of time here to talk through this. I even thought about giving y'all this as like a homework kind of thing and giving you some actual articles and a search to work through, if that's something that you're interested in. The next slide that I have does talk about, does give you all the reasons why the articles didn't come through. So I do have like the answers here. I don't know if people are interested in this kind of examples. So what do y'all think? I know everybody has their own way of trying to figure this out. This is my way. I'm a line searcher. Ovid was the first interface I learned how to search in. So, okay. So I do have an exercise that I'll put as part of the pre-reading for the next time, where it won't be abstract like this is. It will be an actual search and articles that you're trying to figure out why didn't they come up in the search. And so I'll put that in there, and then we can talk about that next time. I'll see what I can do for PubMed. I'm not super great at searching PubMed. I kind of, but I will do my best to give you an example for that. Sure. So I was just using this as one way. Sometimes you have things as paragraphs or other things, but you can still do the same kind of idea in PubMed, especially if you were on the advanced screen in there. So, but I know this is kind of an abstract way of thinking about it. How do I know line 15? Okay, so let's see if I can give you the quick explanation here. So on line 15, I'm saying, okay, show me all the articles, the 4 that I got, but not that don't have the concept B in it. So line 14 is showing me, oh, I did get 3 of the 4 articles in with my criteria that I have for concept B, and then line 15 is the one that I didn't get back. So I hope that makes sense. Sometimes I have to draw pictures and stuff to walk through this. I did tutor in logic for several years, so that kind of helped me get a little, and of course I got to look at this already, so I kind of already know the answer too. So sometimes drawing pictures helps, and it does help when you don't have an abstract idea like you have the actual one. And so that's what I'll put into the pre-reading as an actual example that you can work through. So I'm sorry to kind of throw this in here at the end. This is a topic that always comes up at some point in working on a systematic review, and so I did kind of want to show y'all some examples from there. We can go over this next time in more detail because we'll have time then. So sorry to kind of throw it in at the last minute here. Please, if you want to work through that example, it'll be in the pre-reading, and our next time to meet will be after MLA on May 16th, where we'll kind of wrap up the series, and we'll talk about your role in the explanation and summarize step. I will be doing some presentations at MLA. I'll be on a panel talking about developing systematic review services, and then the systematic review SIG will have 2 meetings. Everybody's welcome to come to either one, so one's our business and one is our informal meeting. So those are my main things that I'm doing there. So I didn't even think about putting it on here.
All right, well, thanks so much, Margaret. I'll definitely have people be on the lookout for you. We'll do have a couple of final housekeeping for everyone else, so if you'd stick around for just a few moments. But thank you again, Margaret, for a great session today.
Oh, thank you. I always learn so much from everybody.
All right, I'm going to go ahead and stop the recording for today, and we'll go into our final housekeeping.